Welcome to the Murrumbidgee Local Health District. This video is to talk about the importance of partnering with our communities and with our people and our patients and helping them to be involved in decision making about their care. It's also about your role in that, and that can help us to improve outcomes for people right across our region. So it's a priority for everybody in Murrumbidgee Local Health District to involve patients as partners. This way we can help people and enable people to be responsible for their care and improve their well-being. So all staff who work in Murrumbidgee Local Health District are involved in National Standards 2. And National Standard 2 is about partnering with patients. If we involve patients in their care and in their decision making about their health, their procedures, about their well-being, about their decisions in their lifestyle choices, we together will improve outcomes for people right across the Murrumbidgee Local Health District.
Patient-centred care is all about what it says, and that's putting the patient at the centre of everything that you do. So all the decisions that you make, all the conversations that you make, all the interventions that you do are all with the patient at the core of that. And it's all done in consultation with the patient so that they're part of the outcome that's expected and the journey towards getting better.
I think the most important thing to a patient is that they are respected, they are treated with kindness, and that we tell them what we are doing and why we are doing it and engage them in that process.
The most important thing for a patient when they first walk into the hospital is for someone just to listen to you. You know, you go into the ED triage or wherever you might be, or if you're just calling, you just want someone to spend the 5 minutes to speak to you and to just listen and to get you where you need to be.
So patient-centred care is about putting the patient at the centre of their own recovery, empowering them to make choices about how they want to be treated, if they're well or if they're unwell, what works for them, what doesn't work for them, and really helping them to make some choices about their own journey.
When we're advocating for patients, the most important thing is that they have a good experience. So it's all about them. You want their experience to be as stress-free as possible and that they have a good outcome.
I think the most important thing for the patients is to feel as much as at home as possible. And that means you've got to stop and have a chat to them, to make them feel comfortable.
So patient-centred care, I think from a patient's perspective, is certainly very much that they are involved in that care planning. And I think we do that by ensuring that we have a culture that is inclusive and supportive. Because if we have staff that are happy, professional, have the skills that they need to deliver the care, then the patients are going to be the ones that actually benefit at the end of the day. And that is very important to me.
I think the most important thing for patients, residents and for clients is being treated as an individual. It's important that we as health practitioners don't put people in boxes. We're not all the same. We've all got different needs.
Patient-centred care is, to me, is where a goal is met in relation to the care and the outcome for the patient, and both the patient and the staff are working towards that same goal.
So patient-centred care means to me that the patient is involved in their own care, that they understand that the consumer's able to ask for in their own words about their care and what care will be provided and what care that they would like to be provided. And to be empowered to ask those questions and feel comfortable in a safe environment within the health system or their health service to be able to ask those questions and receive that information.
For me, I like to sit down with my patient and talk to them, find out what brought them into hospital, how they're feeling, what their pain's like, whether they've got a supportive family, if they're younger, a child. You need to orientate the parents as well to make them feel safe and secure.
I think the most important thing is communication, whether it be just talking to them or listening to them, asking them questions, just kind of making the experience not just about the sickness that they have, but about their whole life.
So we're very conscious that our patients and carers have the best possible experience in the healthcare system that they possibly can.
So I think the most important thing, like most things in life, is communication, and it's communication between every aspect of contact with the patient, from the clerical staff to the nursing staff to the medical staff, for us to use language that they can understand, to make sure that when we have explained something to them that they have a good comprehension of what's going to happen, and to make sure that the families are also sort of well informed and involved in the decision making process.
I think it's important that a patient is heard, that they have all of their concerns and their fears and their anxieties understood. And I always try and get a collateral history from family, so talk to their significant other or others who come with them, because they also have a view and they need to be included in the conversation about where to next or what happens next.
My belief is that we have to put the patient at the centre of the universe, because they are the most important thing to us in health. Without them, we can't deliver a health service.
I think you've got it right when the whole patient experience, when someone can walk away and the whole family can walk away feeling relieved and happy and sort of at peace with, and they can sort of tell their friends this positive experience.
I think we know when we got it right, when our patients succeed, when they improve, when they achieve their goals, when they express satisfaction with the care that they've received, and when they can live independent, happy lives in their community.
Look, I think the way that we tell that we've got patient-centred care right is by listening to our consumers. We really need to listen to what the patients and the clients are sharing with us.
I live by myself, and when I was discharged, everything was put in place for me. Home care was arranged, community nurse, and everything was spot on.
Well, I think when we get it right, that can be in the form of feedback. So whether they give you that verbally and say that they were happy with their experience, that their expectations were met, that they understood what had happened to them, that they were happy with the outcomes, that they know where they're heading is the best outcome.
I think health workers know that they've got it right when they see the patient or the consumer living a holistic, healthy life, being happy and empowered in their own individual life and lifestyle, and also the fact that they're not representing to the service like over and over again. So,
a good patient experience can be measured by timely discharge and a smile on the patient's face.
Look, I think my role as a leader and focusing on patient-centred care is pivotal. It's about leadership, and it's about, every day when I'm out and about in the facilities is, talking to people, talking to patients, talking to families and talking to staff. And I think by demonstrating that as a senior leader, I think people really then start to get the message that this is really important. It means a lot to us as an organisation. If we have happy staff, we have happy patients usually.
Well, I suppose a good patient experience is when a patient not only receives good clinical care, but they feel that they've been involved in the process and that the outcome for them is the best that could be achieved under the circumstances. And sometimes, the circumstances and the outcomes aren't the best, but we can still do everything we possibly can to make it the best of what is on offer.
I think when I feel like I've worked well with the carer and I feel like that is reciprocated, it's when you've got those good communication, that foundation down, that there's some good communication happening. You can see that that person is better in themselves, there's confidence that's coming through, but there is some proactive stuff happening from management down to realise the importance of carers, that they're out there. A lot of them are giving me feedback that there's nowhere to turn, they don't know who to speak to, and we're starting to try to help them find out who to turn to and who to go to for some help for themselves.
New staff need to remember that we're not the experts in people's recovery, the patients are, and probably the most important thing they can do is understand that we can't be the experts in other people's lives.
The staff are always so jovial that it lifted your spirits, and it's a credit to Lockhart to have a hospital like this. I was so grateful for the nursing staff here and also the management and the doctors. They were all just so understanding and great. They improved the quality of your life.
Okay, so far you've heard a lot about patient-centred care. Murrumbidgee Local Health District's aim is that all of our services always will put the patient at the centre of all decision making regarding their care. National Standard 2, partnering with consumers, is also about working with our patients, carers, consumers and the community at all levels across our organisation, from the bedside to the board. We partner with patients or consumers and carers in service and program planning and evaluation. It's important for us to do that because consumers and patients are the ones who experience the services that we provide, and whether we're planning a new service, developing a new facility or evaluating something that we've already got operating, we need to understand the impact of those services on the people that actually receive the care we provide. Sometimes it's not always thinking about the care that we provide necessarily to the patient or for us on focusing on patient care, but it's also about what matters to the patient or what matters to their family. Those things can have an impact on the ultimate care that we provide. It's important when we're working on developing new services or building new facilities to engage with the community, because they are the ones who experience the services that we deliver. And if we want to actually understand the impact of what we do on them and their lives, we need to actually understand it from their perspective and find out what their needs are so we can deliver the best and most appropriate care. It's also important when we think about engaging with consumers or partnering with our community, remembering that we have a very diverse population, to ensure that the consumers that we engage with also come from that diverse population group and we have a fair representation from across the community. With particular reference, or particularly important to us, is the Aboriginal community.
So no matter what your role is in the Murrumbidgee Local Health District, it is now up to you to work with us as part of the team in partnering with patients so that we can provide them with the best health outcomes and experience in our local health facilities.